Hi, I'm Jude Robinson. I am the IPS president, and I'm with colleagues today for our clinical conversations. So I'm just going to let those in the room introduce themselves. Kerry?
Yeah, hi everybody. I'm Kerry. I'm Jude's Vice President, Infectious Prevention Society, and in my day job, I'm Deputy Dipsy for Gloucestershire Hospital's NHS Foundation Trust. And I'm really excited. This is our second clinical conversations. The first one went well, I think, Jude. We had some really nice positive feedback.
Good.
So we thought we've got to go on a high, and then that high we've now brought Danel, who is anyone who knows Danel, who keeps the positivity, keeps all the energy. So I think our second one will just go just as well. So Danel, please introduce yourself.
Yeah, so my name is Danel Meno, and basically my day-to-day job. I'm the education lead for IPC at Whittington, so it's a hospital based in North London. But I also do a lot of work for well, not a lot of work, but I do support the IPS.
You do a lot of work. It's okay, Danel. You can.
I do help in two committees, so it's the EPDC and the SPC committee as well. So that's me. Thank you.
Fantastic.
Thank you. So today we really wanted to big up infection control and really celebrate the great professionals that we have working in our field. And this is where Danel comes in. So Danel won a National Infection Prevention and Control Nurse Award in 2024. So we really wanted to bring Danel in today to really talk about what that really meant for him, tell us all about his work, so we can actually maybe take some of that learning and take it into our own areas of practice. So we're really excited to have you, Danel. And I think the first thing to really ask you is tell us about what award you won and why.
Basically, I had a massive honor to be nominated and sort of receive the award in the infection prevention category for 2024, I must say. And that was for the British Journal of Nursing Awards. And I suppose there were quite a few projects that I was leading that sort of led me to receive this award. And I must say that I didn't put the proposal forward. I had a wonderful boss at the time. Her name was Julie Singleton, who is the current lead for Homerton, who put the application forward. So actually, I didn't even know that I was nominated.
Oh,
And
wow.
funnily enough, I just received this sort of like random email on a Monday morning from the BJN saying, "Oh, Danel, you've been nominated for this award." And it was
That's a
sort of
nice
like,
Monday morning email for
well,
a change, isn't it?
yeah, the funniest thing is that I thought that it was a spam or sort of like a dodgy email. So I completely ignored it for days. And then the sort of like the administration of the BJN came back to me saying, "Oh, Danel, we really need to hear back from you and just sort of confirm if you're going to come and attend the ceremony or not." So at that point, I was like, "Oh, you know what? This is probably real." So I went to my boss and I was like, "Well, someone must have nominated me because I haven't put myself forward." And she did, mention that she put the application forward. So I'm very grateful for my previous boss, who made this beautiful application. And basically what she did is basically sort of outlining a bit of a summary of the projects that I was leading at the time. I suppose I was leading quite a few projects. One of them was around peripheral line documentation, and I've managed to sort of create a new app where nurses can basically input data at the point of care, and they get lots of visual prompts, and it's sort of like something that can be just done at the point of care so that you avoid that recall bias, basically. So that's one of the things, and I'm planning to do a poster on this at the IP 2025 for this year.
Loving that. Thank you, Danel.
So that's always good.
Shout out for conference. Love it.
And the second bit, so there are quite a few projects, but those are the two main chunks, right? The second bit was my project around removing gloves during IV drug preparation, because what happened back in 2022, I had a massive increase of central line bloodstream infections in our ITU, and we did a lot of observations. We took lots of observations for about 3 months for inserting central lines, and then how we're looking after those central lines. And what we noticed is, well, basically, nurses were preparing drugs and actually using the same pair of gloves for administration of IV therapy. So obviously, lots of lapses of opportunities for hand hygiene. And so basically what I did is just remove those gloves and just basically for staff to basically risk assess if those gloves were needed or not. And since then, we've seen a noted decrease in the number of central line bloodstream infections. It's been sort of a good project in terms of from an environmental point of view as well. So suppose those were the two main projects that potentially led me to winning this award. Which has been very humbling, and it's been sort of a lifetime achievement for me and absolutely wonderful. So yeah, it's a day that I will never forget.
I can imagine. What was the award ceremony like? I'm sorry, this is where I get to the social things, don't I?
No, it's
like,
really
it's
fun.
a very glamorous
It's
event,
amazing.
these things are, aren't they?
It's actually really fun. So basically, it's hosted at the BMA, so that's the British Medical Association in Tavistock Square, central London, and it's sort of a black tie event. And the beauty of that event is that you have lots of different specialties across, right? So you have a table dedicated for infection control, then you do have other specialties like vascular access, diabetes, nutrition, etc. And I don't know, the whole ceremony is very uplifting because you can see that, I don't think we're very good at recognizing specifically nurses and sort of promoting ourselves, but for the work that we do, and lots of the things that we do go unnoticed. So I think it's very important that you have that sort of, that recognition. So the whole room is sort of, it's very uplifting experience, I must say. It's been wonderful. Yeah.
Oh, that sounds absolutely amazing.
Yeah.
How did your colleagues and your friends and family react to you win?
So that's quite funny because I thought I was going to win. I must say that at that year, I had like two of the other people who were nominated for the award. And this is the beauty of like the British Journal of Nursing Awards, because the moment that you get nominated, you do have 3 categories. So there's someone who gets the bronze award, someone who gets the silver award, and then someone who gets the gold award, right? So whatever happens, you do get that part of your recognition, which is amazing. I think it's actually quite cool that, they did that. I suppose during that year in 2024, I was so convinced that I was not going to win because I had 2 beautiful contestants. One is Rashmi, who is a clinical nurse specialist in King's College, and I believe she did a lot of work around improving hand hygiene compliance with wipes and patients. So it was kind of interesting because in a sense, lots of quality improvement projects that we do in infection control, we often forget patient involvement, and I think that was quite interesting. And the other nominated person was Liane, who I believe I'm not sure if she lives in Wales, but she did a beautiful campaign about hepatitis C reduction in the community as well. So when I looked at my 2 opponents, I was like, no way I'm going to win this award. But just the fact that I was nominated and had that wonderful experience, it's a day that will stick in my mind. And obviously my teammates were all over the world when I won the award. Because obviously it's not just about you, right? Anything that you do in infection control is, you're working with several team members and your colleagues. So perhaps I've received that award, but it sort of like reflects the sort of efforts that we do as a specialty and as a group. And my mom was all over the moon, obviously.
That's a little proud mom. I love that.
Proud mom.
Oh, and that's what's really cool about the British Journal of Nursing was we're talking about. We support that in the Infection Prevention Society, so it's really nice to. You've obviously talked about some of the people that were nominated and shortlisted, and what's nice is that in the Infection Prevention Society, as part of being that panel, we also get to read so many amazing nominations, and actually some of that fantastic work that's going on is so great that people are putting each other forwards to kind of celebrate that. That's what I love about conference, that we get to do that celebration together. We get to read other people's work in abstracts and posters and oral presentations. It's really about that sharing of knowledge and that coming to the community to celebrate that kind of innovation and that research. So that's great. So you've obviously mentioned about winning an award on the day, and how has that changed though your own work and your career? Has it kind of led you to some more opportunities or new connections?
Definitely new connections. I suppose having that level of recognition, I feel like it definitely has made me more confident on my job as a day-to-day job. And I feel like there's definitely been more connections in the sense that I've been sort of presenting at a few conferences for the British Journal of Nursing. And also like just sort of give me also the confidence to put myself forward for the IPS. So when I finished my master's, I thought, you know what, it's probably a good time for me to start giving something back to the society. And I'm a current member of EPDC and SPC, and I thought, well, yes, perhaps I don't have as much experience as you do, for instance, like you and Kev, like Jude and Kev. But I suppose yeah, you know, we need new sort of like fresh air into the specialty, and there'll be lots of people who are basically potentially retiring in a specialty as well. So we definitely need that sort of investment in new people, and yeah, just put yourself forward. I always strongly encourage all the people in the specialty to you know to just chip in and help a bit for the society to sort of increase the network and you know the sort of you know knowledge of the specialty as well. I think it's very important. So yeah, there's been a lot of opportunities, and it's been wonderful. One of the best things about winning this award is that the British Journal of Nursing actually sort of offers you to do a short article on your award. So if anyone is very interested in about noting what I did in 2024 to win this award, you can just Google Danel BJN, and they can, you know, the full article is there.
I love that.
Oh, amazing.
So there's an amazing sort of add-on to this sort of award as well.
Oh, brilliant. It sounds like such an amazing sort of experience. It's fantastic to hear. So what have you had any feedback or recognition from others in our IPC community since the win?
Do you know what? I think not directly. Obviously, my EPDC colleagues have been amazing, and we're all celebrating. I suppose you do. I mean, you know, that it has that sort of knock-on effect. Right? When you have that winning experience and you get that recognition, and I suppose I suppose that, you know, even if it's not directly, indirectly, I feel like you almost get that sort of level of respect and recognition as well. So I think it's been absolutely wonderful, and I will strongly encourage anyone who's thinking about, you know, nominating anyone else or even themselves as well, because at times, you know, that could be also an option. But yes, put yourself forward, just do it. I think it's a beautiful way of, you know, showcasing what we do as a specialty, because what happens in infection control, a lot of what we do is often been in a mode of like crisis mode or sort of firefighting. So you often don't have time to stop and think, oh, this is what I'm doing in order to ensure patient safety or whatever. And I think it's very important that we do that as a specialty, because lots of the things that we do go hidden or sort of, you know, not very obvious. So I think it's very important that we showcase what we do, because I think it's, you know, pretty important and fundamental. So yeah.
Absolutely. Yeah, I think you're absolutely inspirational, Danel. I really do.
You are.
And yeah, well deserved win there. Absolutely.
You've got the new practitioner who I think you said that you knew, didn't you? Or at least
of course, yeah. I did have a chance to meet her, because I was actually invited for the 2025 ceremony. I was not meant to be there. So the sort of like the partners and the judges are Nick Hughes from EPDC, and then we have Karen Warrens as well, who are basically the judges. And unfortunately, Nick couldn't attend this year, the ceremonies. They asked me to go as sort of, you know, the representative for 2024. So I had the chance to meet our nominees for this year. So we had Martina Cummins from BART, who is the clinical director of IPC, and then also we had Sharon Reed, who is basically the deputy DPC at University Sussex. But the winner for this year is Helen Rosenti. She's the deputy head of IPC at Anne Vavan University Hospital, and I can't really comment on her work because I was not part of the panel and judging who was the winner this year. But they were all absolutely lovely, and I'm really, really happy for Helen, who is the winner of this year. Yeah. So a massive congratulations for her.
No, well, honestly, amazing. It's so great to see. And I guess, was there anything new that you're working on? Any spoilers for anything, any new projects, or it's just carrying on all the good work that you've already done and just continuing on that and building on that?
Do you know what? I had a few projects that they do need a bit of tweaking, I must say. Like, you know, it's like, you know, anything in quality improvement projects. You implement something, and then there's further feedback, and there's further BDSAs to be done. So that's what I'm doing currently. But I'm actually doing a diploma in tropical medicine at the London School of Hygiene and Tropical Medicine, which is purely focusing around nurses in global health. And there's a lot of like parasitology and talking about emerging sort of diseases and vector-borne diseases as well, which, I mean, often most of these diseases, they're not sort of person-to-person transmission, but actually, you know what, like climate change and all the new challenges that we can have in infection control. I think it's very important that we keep ourselves ahead of the curve and really understand what is this sort of like mode of transmission of these pathogens, and actually be able to give better advice, right? When you have anyone coming with all this fancy and wonderful diseases.
Absolutely.
I think it's very important.
Keeps us on our toes, isn't it?
Yeah, absolutely. You always get this,
Absolutely.
weird calls on a Friday afternoon.
Oh gosh, yeah. Tell me about it. 5 o'clock. We all know those, don't we? Oh, thank you
Yeah.
so much. Oh, so we'll wait for that next bit of work then, Danel. I'm sure for
Yeah.
presenting at probably a subsequent conference. Thank you. And I guess just to be lovely to finish up. And I know that the IPS awards have just finished in terms of their closing for their nominations, and our panel are they've got a hard job of now trying to narrow down some winners. But we are really proud of our IPS awards. We have a fantastic suite of awards. We've got the IPS Impact Awards that are really linked nicely to our strategy. We have 3 categories within that area, and that's looking at Award for Excellence. So that's aiming for and achieving the best in IPC practice or education. We've got an Award for Patient Experience, again, putting that patient at the centre of IPC practice. And then our last award is Award for Nurturing IPC Talent. So that's supporting the development of IPC workforce for the future. So kind of remnants of all the things that you've just been talking about. So hopefully I really look forward to listening to those nominations and those that got shortlisted, and really looking forward to the award ceremony at conference this year, so we get to hear all about them. We also have some fantastic other awards. We have the Brendan Moore Award, which is again recognising it was one of the first epidemiologists that recognised the need for IPC nurses. He was also president for the first president of the Infection Control Nursing Association. So again, really cool to see that award coming through every year. And then if we're lucky, we also have the ALIF Award, which obviously is a kind of a lifetime achievement award. There's a very elite cast of people, that one, I think, in terms of the people that go for that one. So, and then obviously we have honorary memberships. So whilst they are closed now, we are really excited that there will be opening, the awards will be opening this year at conference, whereas normally they open later in the year. So hopefully people feel inspired at the next conference, or at a conference this year, to think about, actually I should be nominating my work for that, or even nominating their colleagues. So yeah, definitely looking forward to that. And I think EPDC are part of the judging panel. There's a rep from EPDC that goes on to that. So really exciting. So yes, look out for that, people that are listening, for our future awards. We've happened to have lost Jude on the way, so I'm hoping Jude will join us at some point. Bless her. So signal issues, as always, is a problem with Teams, isn't it?
I'd just like to say a massive thank you for coming and talking to us now. As I said before, you are such an inspiration, and I do hope that your story really encourages others to nominate others or nominate themselves for these wonderful award categories that are, advertised around by not just our society but other institutions as well. So just a massive congratulations, Danel, from me.
Thank you. It's been an absolute honour. Thank you for having me here today. It's been wonderful. Thank you.